Hi, I'm Dr. Christopher Comstock at Memorial Sloan Kettering Cancer Center in New York. I'm in the Department of Radiology and I specialize in breast imaging. I have been in breast imaging for going on 25 years. I started in a fellowship at the University of Chicago, and I worked at Northwestern and was then the section chief at San Diego of breast imaging, where we brought up, implemented digital mammography, and now I'm in New York at Sloan Kettering doing mostly clinical trials in breast imaging.
Wonderful. My name is Dr. Corey Speers. I'm at the University of Michigan in Ann Arbor, Michigan. I'm a radiation oncologist and a physician scientist, so I have a research laboratory and also run a clinical practice focused on breast cancer, really interested in ways in which we can make radiation more effective for women with aggressive forms of breast cancer, but also interested in understanding ways in which we can identify women who don't need radiation after their surgeries, and have been at Michigan since my training. I've been there for about 10 years or so.
Oh, I'm very honored to get the invitation. My wife is actually Korean, and so this is my fourth trip to Korea. I love coming here and didn't get a chance to bring the kids, but hopefully bring them soon. It's always a pleasure to come to the conferences in Korea. The KSBI is a very prominent group globally in breast cancer imaging, and lots of collaboration and participation in a lot of different meetings. So it's always an honor to come to Korea and to come to this global conference in general.
When I first received the email, I honestly thought it was a mistake because such wonderful luminaries in the field have been part of this conference in the past, and I was very honored and excited for the opportunity to participate. There's been some wonderful, as I mentioned, Dr. Tutt and Dr. Dowsett and many colleagues that I have collaborated with in the past who are going to be plenary speakers at the meeting. I was very excited to join them and have this opportunity to come to Korea and meet with colleagues here to talk about all the wonderful things that are happening within breast cancer.
It's, with COVID and in breast imaging, and I'm sure in the other specialties, and it's a very small community. And it's been a while since we've had live meetings, and virtual conferences. It just isn't the same networking amongst professionals and in the field. So I was more than happy to travel, just because I think it's important to participate in these types of meetings. And virtually, it's not the same. You don't make the same connections.
Yeah, very similarly. I was excited to make the trip because I think there are advantages to interacting with people in person that we have missed out on the last 2 years during the pandemic. The opportunity to interface and meet colleagues face to face, to talk to them, to get to know them, I thought was well worth the trip to come over. And such a well-organized, such a well-run conference really made the decision easy to come.
This conference in particular really brings together all the specialties, oncology, surgery, breast imaging, radiology, and radiation therapy. So I think it's, and with all the international speakers, I think it's really a prominent meeting that brings such a broad group of physicians together towards one goal, and that's improving, reducing mortality from breast cancer. So it's a really prominent meeting because of that combination of all the different specialties. And I have to say, the meeting and Duna, the meeting planner for me, has made this very easy. Everything's been arranged and very organized, so it makes it much easier to travel.
Yeah, I would say that this meeting is different in that it's more intimate. It brings together experts within the field, which is nice to be able to talk to our colleagues in surgical oncology, medical oncology, imaging with radiology, and have those conversations in a way that are difficult at larger meetings. And then it's just so well organized and so well run, but high quality in terms of the content that's presented, and the types of talks that are being given is really top notch.
I liked some of the AI, the artificial intelligence lectures in multiple specialties here, and I think that's a promising new area in improving therapy and outcomes and reducing unneeded therapies. So I think that's probably the best part of the meeting. The most exciting in terms of new trends is the AI techniques.
I've been excited for so many of the sessions, including this morning with Dr. Comstock. In that session was wonderful. I really think the plenary lectures are extraordinary. So Dr. Tutt talking about the integration of PARP inhibitors in the management of patients with breast cancer was really enlightening. I think Dr. Dowsett has a plenary lecture tomorrow, which I'm really looking forward to on the role of endocrine therapy and how that's evolved. And so there's just so many great sessions that I look forward to throughout the rest of this week. Ours is saved for the very end on Saturday. I think that's going to be a great session as well, understanding how we can integrate radiation into the management of women with breast cancer and how we can more appropriately select women to de-escalate therapy for, which I'm really looking forward to that discussion.
Yeah, it's wonderful to participate and meet the different people from different countries and different programs. And really, I think that's the important, is the exchange of ideas. And I have to talk to you about some of our at the NCI ECOG Akron, we're working on where we just had a conference call this morning working with the NCI on a trial looking at combination of breast MRI for DCIS patients and Oncotype DCIS score in trying to reduce radiation therapy in those groups. It's a very challenging thing, so unfortunately I'll miss the discussion, but so it's those cross communications and sharing of ideas that I think really, hopefully the rest of the attendees, that's what I find really intriguing about the meeting.
Yeah, I would just add that this is one of the first meetings that we've been able to be back in person since the pandemic, and I would just encourage people to take the opportunity to get to know people, to talk to people that they haven't seen before or don't know well. I think that opportunity to interface with people and learn from different specialties, from different institutions is really enriching. And really the strength of a conference like this, it gets people together, allows them to speak face to face and really learn from one another in enriching ways. GBCC, très good.